Hi, I'm Karen Zink. I want to tell you about a friend of mine who died in the hospital recently. She was admitted to the emergency room for end-stage lung disease. She was with her adult daughter at the time. The patient had an advance directive and did not want to have any form of artificial ventilation and signed a do not resuscitate form. A do not resuscitate band was placed on her arm. And during the course of her admission, her condition deteriorated. Her daughter, who was with her, approved artificial ventilation through BiPAP. Her estranged daughter from out of state wanted everything done for her mother, which resulted in having her advance directives overridden. She was transported to the ICU and died there. I suggest that we all have kitchen table conversations about this issue to avoid unnecessary distress and turmoil in the family and for the loved one. And the distress and turmoil can last the rest of the family's life. Thank you.
Hello, I'm Dr. Bob Cox, an infectious disease specialist. During my career, I've seen far too many situations where families are torn apart by choices they have to make for loved ones who are unable to speak for themselves. For example, the mother who's been battling cancer for years through surgery and radiation and one cycle after another of chemo, and she's losing the battle. She's tired, ready to give up, but in so much pain that she's constantly sedated with narcotics. And then there's the grandfather with Alzheimer's, who had a stroke 6 months ago, leaving him partially paralyzed, unable to speak, unable to eat or swallow, so that he's fed with a tube at the nursing home. In these situations, the family has to make decisions for these patients, and the families aren't always unanimous. Most of the time they want the patient kept comfortable, but occasionally a spouse or a daughter will want everything done, and as a result, the family's torn apart and they're fighting and arguing. The same situation can happen with young people. The college student rendered permanently and irreversibly brain damaged as a result of an accident over spring break. College kids don't think about this. No one knows what he'd want to have done. If patients in these circumstances had done advanced care planning, they would be in charge. We could do what they want us to do. Based on what you've heard, I hope you recognize how important this initiative is. I hope you will join us, make a contribution, read the information on this site, and pass it on to your friends and loved ones. This impacts everyone, and we hope that by developing a functional model, we'll be able to share this across the country, including to your community as well. Thanks very much.